Hello, everyone, and welcome to our presentation. First of all, let me thank you for coming here today. My name is Marinel, and together with Kay, Max, Fleur, and Cindy, we're looking forward to be talking with you today about our topic on diabetes self management training, 21st century diabetic drugs, and herbal diabetic medicine. We thought it would be useful to divide our talk into four main sections. First, I will be talking about the objectives for this presentation and a little info about diabetes. Second, Kay will be presenting about DSMT or diabetic self management training. Third, Max and Fleur are going to talk about 21st century diabetic drugs. And lastly, Cindy will be discussing about herbal diabetic medicine. So, let me first give you a brief overview of our objectives for today. By the end of this talk, the viewers will be able to first understand the importance of managing diabetes. Second, familiarize current and new medications used for diabetic patients. Lastly, identify herbal substances in the remedy of diabetes. Now, let us take a look at diabetes as a bigger picture. We will not be digging deeper on the pathophysiology of diabetes as we are all aware of what it is, but rather we will be talking about diabetes in numbers. So, according to the CDC, more than 37 million people in the United States have diabetes, and 1 in 5 of them don't know they have it. Also, 96 million US adults, over a third, have prediabetes, and more than 8 in 10 of them don't know they have it. Plus, diabetes is the seventh leading cause of death in the United States, and it may be underreported. Additionally, type 2 diabetes accounts for approximately 90 to 95% of all diagnosed cases of diabetes, while type 1, on the other hand, accounts for only 5 to 10%. In the last 20 years, the number of adults diagnosed with diabetes has more than doubled as the American population has aged and become more overweight and obese. This, in turn, has an effect on our economy. So, the cost of this no- rise of cases totals to 327 billion yearly, and also medical costs for people with diabetes are twice as high as for people who don't have diabetes. Based on these statistics, America is facing a serious issue. In order to help diabetic patients manage their disease, the government has implemented a program called Diabetes Self Management Training. This program will be further discussed by my colleague Kay. Kay, take it away.
In this presentation, I will be discussing about diabetes self-management training. What is DSMT? Diabetes self-management training is an evidence-based program that incorporates the needs and goals of people with diabetes into a personalized plan to improve health outcomes. The program topic includes nutrition, physical activity, how to monitor and interpret glucose levels, medications, healthy coping skills, and also preventing and managing diabetes related complications. Now, let's talk about patient qualifications. People who are diagnosed with diabetes and are taking insulin and medicine are qualified. Also, people who are at risk for diabetes related complications. Moving on to the steps and settings. DSMT usually occurs in hospitals, in physician practices, in clinics, diabetes centers, and pharmacies. DSMT has 4 steps. The first step is referral made by a clinician. The second is scheduling with a diabetes educator. The third one will be the initial visit that involves a 60-minute virtual or in person one on one consultation with diabetes educator. And the last step is education. It will include 9 hours group training and 1 hour individual training, 2 hours per year afterward indefinitely. Why is DSMT important? Number one, it will reduce healthcare costs, including hospital readmissions and emergency visits. Another benefit is that it improves hemoglobin A1C as well as blood pressure and cholesterol levels. Also, it will improve medication adherence. Another important benefit is the prevention or delay of onset of diabetes complications such as heart disease, kidney disease, and vision loss. And finally, it will improve quality of life and it will improve lifestyle behaviors for a healthier patient. Now let's talk about diabetes education algorithm. This will guide healthcare providers when to assess, provide, and adjust DSMT. There are four critical times to assess, provide, and adjust diabetes self management education and support. The first one will be at diagnosis. This will ensure that both nutrition and emotional health are appropriately addressed. Number two, annual assessment of education, nutrition, and emotional needs. This will assess the knowledge and skills, and also if there is any change in medication or if the HbA1c is out of target. The third one is when there are new complicating factors that will influence self management, such as health conditions like stroke and renal disease, also physical and emotional limitations and difficulties. And lastly, when transitions in care occur, such as change in living situations, in the medical team, or if there's a change in insurance coverage, and also age related changes affecting cognition and self care, etc. So that sums up the topic about DSMT. The next topic is about 21st century drugs, which will be discussed by my colleagues Flor and McKay.
Hi everyone, so my name is Max. Today I'm going to be presenting the 21st century drugs for diabetes mellitus. Okay, so first of all, I just wanted to acknowledge that some of the information that I will be presenting is from a lecture about diabetes 21st century update medications for the 20th century population by Mary Korithowski. So we're going to start the presentation with the 2018 American College of Physicians recommendations for drugs, for the diabetes mellitus drugs. So clinician should first personalize goals for glycemic control in patients with type 2 diabetes on a basis of discussion of benefits and harms of pharmacotherapy, patients' preferences, patients' general health and life expectancy, treatment burden, and cost of care. The second one is to achieve an HbA1c between 7% and 8% in most patients with type 2 diabetes. Consider de-intensifying pharmacologic therapy in patients with type 2 diabetes who achieve HbA1c of less than 6.5%. And the last one is to treat patients with type 2 diabetes to minimize symptoms related to hyperglycemia and avoid targeting an HbA1c level in patients with life expectancy of less than 10 years due to an advanced age of more than 80 years, those who reside in a nursing home or have chronic conditions such as dementia, cancer, and stage renal disease, severe COPD or CHF, because the harms outweighs the benefits of this population. Okay, so the first drug I'm gonna present is the sodium glucose transporter inhibitors, or known as SGL2I. They're also called glyphosins, and they have been approved for treatments for diabetes since 2013. So they work by preventing the kidneys from reabsorbing glucose back into the blood, and also allows the kidneys to lower the blood glucose levels, and the excess glucose in the blood is removed from the body via urine. The efficacy rate for this drug is intermediate. It reduces A1C by 0.8 to 1%. Does not really cause hypoglycemia when used alone or in combination with metformin. It also can cause weight loss. And most of the common side effects is GU infections since it's work in the kidneys. We also have dehydrations, amputations, and fracture risk. And the cost of this medication is high. So more of the disadvantages is the increased risk for euglycemic DKA, high risk for volume depletion, hypotension, anti-hydration, and this needs to be used carefully in the elderly or those receiving diuretics. This is also contraindicated in patients with advanced kidney disease and to be used with caution in men suspected of having prostatic hypertrophy. So these are some of the medications from SGLP2I. So dapagliflozin, canagliflozin, empagliflozin, ertugliflozin. Okay. So the next drugs, they're also part of the incretins. The first one is the peptidyl peptidase IV inhibitor, or commonly called DPP4. So in 2006, the FDA approved a diabetes medicine from a brand new class called DPP4 inhibitors. So this is a kind of enzyme, and they're also called the gliptins. They're very common in the hospital. The efficacy rate is intermediate. It also reduces A1C by 0.81%. The risk for hypoglycemia is low. The weight is neutral, and some of the side effects is increase in nasopharyngitis or URI, headache, myalgia, arthralgia, rarely LFT elevations, case report of acute pancreatitis, and rare case reports of severe hypersensitivity reactions with anaphylaxis, angioedema, exfoliative skin conditions. So these are the common drugs: sitagliptin or Januvia, your saxagliptin, alogliptin, and linagliptin. Okay. So the second incretins that is included is the glucagon-like peptide, your GLP-1 agonist. So these are class of drugs that people use to manage with type 2 diabetes. So GLP-1 is an incretin, which is one of the gut hormones involved in blood sugar control. The GLP-1 agonists help reproduce or enhance the effects of this naturally occurring hormone. So the first GLP-1 receptor agonist was exenatide, which was approved by the U.S. Food and Drug Administration in April 2005 for the treatment of type 2 diabetes. So efficacy of this drug is high, low risk for hypoglycemia. It causes weight loss, and the common side effects is GI symptoms such as nausea and vomiting. And just like the other medication, the cost of this is high. So this is the common medications from this group: exenatide, liraglutide, albiglutide, dulaglutide, and semaglutide. Okay, so the next one that will be presenting 21st century diabetics drugs is Fleur.
Hi everyone. So today I will continue to talk about the 21st century diabetic drugs. So I have here the sulfonylureas, and these are used to control blood glucose level. These are classified into two, the first generation and the second generation. I have here the table listed below with their generic and brand names. So all of the sulfonylureas could cause hypoglycemia. For the first generation, it is declining as there are more effective drugs that have become available, and also they are thought to possibly cause an increase in cardiovascular death. For the second generation, these have several advantages over the first generation, include safer for patients with renal dysfunction, and are excreted in urine and bile. So the next will be anti-diabetic drugs. These are a group of drugs structurally unrelated to sulfonylureas and are effective when used in combination with insulin or sulfonylureas. These includes alpha-glucosidase inhibitors, biguanides, peptidase inhibitors, human amylin, incretin mimetics, meglitinides, and thiazolidinediones. So these are the common anti-diabetic drugs in the table listed below with their generic and brand names. So next is the insulin. Everybody knows what's insulin, right? So it's a drug used to control glucose in patients with diabetes mellitus. So these are the only parenteral anti-diabetic drug available for exogenous replacement of low levels of insulin. So it replaces the endogenous insulin and it reacts with the receptor of cells to facilitate transport of various metabolites and ions across cell membranes and stimulate the synthesis of glycogen from glucose, of fats from lipids, and of proteins from amino acids. So these are the indications: type 1 diabetes, type 2, and short-term treatment of type 2 diabetes during periods of stress. And it's also used as a management of diabetic ketoacidosis, hyperkalemia, and marked insulin resistance. So these are the insulins and the onset, peak, and duration. For the new type 2 diabetes mellitus drug, we have here the inhaled insulin. So it's the Afrezza. This is the only inhaled insulin in the market. It's an inhaler with pre-measured rapid-acting insulin before meals that you used. So it comes with 4-unit and 8-unit cartridges that you pop into a small gadget like the ones come with people with asthma use. So those with asthma, COPD, or who smoke should not use this medication. And it was approved by the FDA on June 2014. For the long-acting insulin, we have the Tresiba. It's an injectable form of insulin that lasts up to 48 hours. So it's only used once daily for type 1 and type 2 diabetes. And it also comes with premixed with insulin aspart. For the longer lasting medicines, so we have here the Beta 5, and Victoza. So when you eat, your gut releases hormone called GLP-1 that tells your body to make more insulin. So the effects of natural GLP-1 only last few minutes. The effects of medication called GLP-1 receptor agonists are similar, but they work much longer. So you need shots of earlier kind of these drugs, such as Beta, Victoza, at least once a day, and this will last up to 10 hours. So there's a new drug, lixisenatide or adlixin. It offers a once-a-day injection option in type 2 diabetes. Other newer drugs last for 7 days, like Tansium, and there's also an extended release exenatide bidurione and dulaglutide Trulicity. So the side effects of all the GLP medications include nausea, vomiting, and diarrhea. So that's all for now. May we call on the next speaker, Cindy, for the herbal medications.
Good day, everyone. My name is Cindy Fatima Santos, and for today, I will be presenting the herbal medicine used to treat and manage diabetes mellitus. Herbal medicine, sometimes known as phytomedicine or botanical medicine, utilizes different parts of the plants, including the flowers, fruits, seeds, leaves, and even the bark and the roots intended for medicinal purposes. Complementary or alternative treatments using herbal medicine have drawn attention to many diabetic patients because there are numerous studies on the common herbs that claim to reduce blood glucose level. Therefore, the possibility of having better glycemic control and being less dependent on insulin injection by using this herbal medicine is unquestionably appealing to these patients, and at the same time, it is also cost effective. For this presentation, I will be citing four widely used herbal medicine for the management of diabetes mellitus. First, let us talk about fenugreek. Fenugreek is a herbal product made from meti extract. The herb is widely grown in South Asia, North Africa, and part of the Mediterranean. A study published in the International Journal for Vitamin and Nutrition Research found that a daily dose of 10 grams of fenugreek seed soaked in hot water may help control type 2 diabetes. Metadona water has the ability to lower blood sugar in people with diabetes. It contains fiber and helps in slowing down digestion process, further regulating the absorption of carbohydrates and sugar. This natural supplement for diabetes can also improve most metabolic symptoms associated with both type 1 and type 2 diabetes by lowering blood glucose level and improving glucose tolerance. The next herbal medicine that I'll be discussing is turmeric. Turmeric is a golden yellow spice that has been widely used for its medicinal properties. It contains polyphenol called curcumin that has antioxidant and anti-inflammatory effect. While research is ongoing, recent evidence suggests curcumin can be used to prevent and manage type 2 diabetes, a chronic condition characterized by decrease of secretion of insulin. Curcumin can have beneficial effects in reducing other symptoms of metabolic syndrome by decreasing insulin resistance through improving insulin sensitivity, suppressing the production of new fat cells, and lowering blood pressure. Curcumin can also help regulate lipid metabolism in people with diabetes by altering the activity of enzymes involved in the metabolic process to lower the level of triglycerides and cholesterol in the body. The third herbal medicine that I will be talking about is something very common to us Filipinos. Bitter gourd or bitter melon, commonly known as ampalaya in the Philippines, is probably not among one of our most favorite vegetables, but most of us are aware of the fact that it is very beneficial for our health. Bitter melon is linked to lowering the body's blood sugar, and this is because the bitter melon has properties that acts like insulin, which helps bring glucose into the cell for energy. The consumption of bitter melon can help cells use glucose and move it to the liver, muscles, and fat. Bitter melon may also be able to help our body retain nutrients by blocking their conversion to glucose that then taps into our blood system. Bitter gourd influence the transport channel for glucose, which also reduces glucose transport into the blood. This effect is important for the treatment of both type 1 and type 2 diabetic patients and help to prevent high sugar level, especially postprandial or after meals. Lastly, I wanted to discuss about ginseng. Ginseng is a well-known medicinal plant used in traditional Oriental medicine, and in recent decades, ginseng root has gained popularity as a dietary supplement in the United States as well. There has been numerous reports of ginseng root improving diabetic condition in both human as well as animal study. In an animal study, orally administered ginseng root was able to counteract the effects of high fructose-induced insulin in rats in after just 4 weeks, therefore decreasing glucose concentration as well as inhibiting insulin resistance. Ethanol extract of ginseng roots prevented weight gain, fasting blood glucose, triglyceride, and high free fatty acid levels in a high induced hyperglycemia as well. Botanical extracts have been widely used as a medicinal agent throughout human history. Many are now available in commercial supplements and are promoted for general health benefits or for prevention and treatment of specific diseases such as diabetes. The advantage of botanical extract is that if botanicals are shown to be effective to improve metabolism and/or risk factors on a clinical level, these remedies in general are commonly available and also cost-effective, therefore could potentially aid ma- drastically the general public with regards to control of obesity and also for management of diabetes.
We would like to thank you all again for coming here today, and we hope you enjoyed and learned from our presentation. Let us all remember that being nurses, we are responsible to impart knowledge to our diabetic patients. And to all diabetic patients, let's all be proactive every day to keep diabetes at bay.